My name is Kaya Richardson, and the issue I chose was the emotional and psychological issues of children in foster care. The nature of the problem. Many children in foster care are placed there because they have experienced some type of physical, sexual, mental, psychological, emotional abuse or neglect. A lot of these children experience high rates of depression, attachment disorder, anxiety, and some even experience post-traumatic stress. They find it hard to enjoy shared experiences with nurturing adults. It's something that they're not used to, so they don't know how to react or, react to it. They experience frightening memories from past experience, so they find it hard to trust adults. They feel unwanted or they feel like they're different. Prevalence of the problem. 80% of the children in foster care has been diagnosed with some type of educational, developmental, emotional, physical, or mental health problem. 30% of the people who have been diagnosed with post-traumatic stress disorder has experienced some type of physical or sexual abuse. Children in foster care are 16 times more likely to have a psychiatric diagnosis, and they're 8 times more likely to be taking psychiatric medication or participate in psychiatric services. 40% of the individuals exiting foster care identify as emotionally disturbed. Causes and explanation. Past traumatic experience is the main cause for a lot of these emotional and psychological issues. The separation of a child from their biological parent or the home, they experience the loss of anything that's familiar to them. The constant movement from foster care to foster care makes them feel like something's wrong with them, and they experience treatment from different treatment from different foster parents. Study number 1: the dyadic developmental psychotherapy. Two major groups were involved in this study. The treatment group, which experienced the dyadic developmental psychotherapy, entailed 34 subjects, while the usual group only had 30 participants. All participants fell between the bracket of age 5 to 16 and met their 3 main requirements. The cases was effectively closed between years 2000 and 2001. They had been diagnosed with reactive attachment disorder, and they have a history of a psychological or physical neglect or sexual abuse. This intervention took place with 33 sessions within an 11-month period. The therapist met with the parent first, which they got a detailed history of the child, the detailed account of the child's history from the parent. Then they met with the child and the parent, where they assessed the child's ability to engage in an emotional relationship. They performed psychiatric tests, and then they met with the parent a second time alone to discuss the assessment and the treatment plan. The results: children in the treatment group experienced significant decrease in symptoms of attachment disorder, withdrawal behavior, anxiety, and depression compared to the control group. The second study was a multi-dimensional treatment foster care program. They had 2 main groups that consisted of children between the ages 3 and 5 who were in preschool and had entered the foster care system through Lane County Care. These children were either new to the system, they had been lying between foster placements, or they were entering the care system. All participants was expected to be in their current living situation for 3 or more months. They had a total of 117 participants. 57 of the participants was assigned to the multi-dimensional treatment foster care program, and 60 participants was assigned to regular foster care program. The assessment of the participants took place in the intervals of 3 to 5 5 3-month basis. The participants of the multi-dimensional treatment foster care program, these children participate in therapeutic playground sessions. They receive services from a behavior specialist who usually worked in daycare or like a home setting. The foster parents receive support and supervision through daily phone calls, and they participate in weekly foster parent support groups and meetings. Um, there was they were available to the staff who was on call 24 hours a day. Family therapists worked with the birth parents and adoptive parents, adopted, related, or non-related parents to teach and inform them of the parenting skills used by the foster parents in the program so that things will be constant whenever the child will place back with their biological family, their adoptive family, or in a long-term foster care program. The results. The secure behavior percentages increased for the intervention group and decreased for the regular foster care group. The avoidant behavior decreased for the intervention group and increased for the regular foster care group. This intervention increased the child's ability to rely on their foster parents for comfort and distress, for comfort when distressed, and to employ fewer insecurity strategies.